our Missouri tax dollars are going to pay for access in 37 other states across the country. Tomorrow, Missourians, by voting yes on Amendment 2, can bring those tax dollars back and start getting the benefit of Medicaid expansion. Throughout this campaign, we've heard from different leaders and organizations on why Medicaid expansion is so important. We have a number of those for you today. One of the things I'm most proud about this campaign, the Yes on 2 campaign has put together one of the broadest, most diverse coalitions to ever come together to pass an initiative here in the state of Missouri. Rarely do business and labor agree on issues, and yet they both are supportive of Amendment 2. We have the Missouri Catholic Conference, AERP, civil rights organizations, doctors, nurses, small business owners, all supporting Amendment 2. That speaks to the caliber of this campaign and really what a lasting impact Medicaid expansion could make in the state of Missouri. So without further ado, I want to bring up a few of those leaders to talk about what Medicaid expansion is going to mean to the state. First, I want to bring on someone who is very familiar with Jefferson City, former State Senator Charlie Shields, who is now CEO of Truman Medical Centers.
So thanks, Jack. And as Jack said, I'm Charlie Shields. I'm President and CEO of Truman Medical Centers. We know for a long time, and have said a long time, that Medicaid expansion increases access for Missourians. And we know that increased access to health care clearly results in better health care outcomes. At Truman Medical Centers, University Health, we think about that all the time. How do we create better health care outcomes? And we feel strongly in support of Medicaid expansion. We think it is the right thing to do right now. It's especially important now in the middle of this global pandemic that we're living with. We know that at Truman Medical Centers, University Health, we provide quality care to people who need testing. We've done over 28,000 tests and people who need care as a result of this pandemic. But we also worry about the uninsured people across all of Missouri. So many of them, we know, forego testing and treatment because they simply can't afford to pay for it out of pocket. And we don't wish that upon anyone. One thing to think about is that many of the current 230,000 uninsured Missourians who would benefit from expansion are the people we need most, the frontline workers, the people that we see at the grocery stores, the people involved in transportation, restaurant workers. Their need for health care is more important now than ever. We have made our position clear. Better health outcomes are what we do, and it's what we are passionate about. Medicaid expansion is right for patients since it keeps them healthy. And in this case, it's also right for the taxpayers of Missouri since we know that preventive care keeps people out of the emergency room and keeps them out of the hospital with much more complicated and frankly more expensive health issues. We absolutely hope that all Missourians will join us by voting yes on Amendment 2. Again, we're voting yes. We support it because it's the right thing to do for our citizens. It's the right thing to do for Missouri. Jack?
As a state, we ask far too much of our healthcare heroes. These essential frontline workers have really gone above and beyond the last couple of months. Now, the number one thing we can do to protect thousands of frontline healthcare worker jobs here in the state of Missouri is supporting Amendment 2. We want to hear from one of those doctors right now, Dr. Tracy Johnson. She's an OB/GYN right here at Truman Medical Center. Dr. Johnson?
Hello. It's my pleasure to talk a little bit about maternal mortality today. I just ran down from labor and delivery, so forgive me for having scrubs on. But maternal mortality is something we feel very strongly about as OB/GYNs in this city. I want to tell you that Missouri is not doing very well as it relates to maternal mortality. And you know that if you have people that are in medicine talking about politics. It's something we don't like to do. We try to stay away from that, and this is something we feel very passionately about. Tomorrow you do have an opportunity to talk about and vote on something that will affect all of you. Some people are going to say, well, I have great insurance. I don't really need to worry about maternal mortality or Medicaid expansion because I am healthy. My children are healthy. My family is taken care of. But this affects every single person in Missouri. There's a couple reasons why. Number one, as it relates to all patients and all people that live in Missouri, we're not doing well as far as taking care of all of patients the same. One thing that we know about taking care of patients in Missouri is that if you have, wonderful insurance, sometimes it's still hard to be able to be seen. That's because when patients do have a little bit more difficult time of taking care of themselves, it's going to backlog our system. It's going to backlog our system in the ER because they're not able to be seen at just regular well care. It's going to backlog the hospitals because we're having to expend more resources to take care of a patient who was presenting late. And it's going to make your frontline staff much more stretched because we're having to take care of things that are much more acute and patients that are much more sick. It also is going to make it hard if you are on the front line. If you're a nurse or you're a doctor or someone that works in healthcare, this is going to help because that money that goes to other states like Oklahoma, states like Minnesota, who have done things like that, they're able to put that money back into their institutions. So places like Truman, we pride ourselves on giving excellent care to patients who have great insurance and patients who don't, and patients who are self-care trying to get insurance. We pride ourselves on taking care of those patients, but a lot of times we don't get paid for those. And that goes for every single hospital and every single organization that deals with patients. So that money is going to now go back into the system to help so that we can cover the services that we're providing for every single patient the same. Lastly, if you do have kids, if you have a family, if you have maybe a niece or nephew or a granddaughter who's having kids, this affects me every single day. How does it affect me? Because I personally have the esteemed pleasure of sitting on the maternal mortality committee for Missouri. So there are about 18 of us that sit on a table every 6 to 8 weeks and we review every single death in Missouri. I will tell you personally that we have 60 deaths in 2017 from moms that were either pregnant or within a year of pregnancy, and that pains us. It pains us in Missouri because even though I'm not from here, this is my home and I feel very passionately about taking care of the people here. In Missouri, we've gone from 39th out of 50 to 42nd out of 50. This year, we're 44th in maternal mortality, and that's because of our inability to be able to take care of patients the same. So it may not affect you personally because you're not having a baby, but it affects everyone here. So we're not doing as well as we could, and you have an opportunity to change it tomorrow by helping everyone by voting yes on 2. Thanks.
Early on, one of our first campaign stops right here in Kansas City, we were glad to stand shoulder to shoulder with the Civic Council of Greater Kansas City. They have been an enormous champion of this issue. I think it really speaks to the economic benefit of Medicaid expansion that so many important business leaders from across the state have got on board and have endorsed this. And now I want to bring up, let you hear from one of those business leaders. Mr. Bill Gautreaux is the chair of the Civic Council of Greater Kansas City. Bill?
Thank you. As past chair of the Civic Council and board member of the Greater Kansas City Chamber of Commerce, let me add my voice today to the broad coalition for support for Amendment 2. Expansion of Medicaid in Missouri makes good financial sense, and it's good for economic growth. More than $1 billion of our tax dollars would come back to Missouri, money that's currently going to Washington, D.C., because that money is funding Medicaid in other states. 37 states have expanded Medicaid, and Oklahoma is the latest state to do so. No state has reversed course since the expansion of Medicaid, not a single one. The data is clear. The federal government would pay 90% of expansion costs. Missouri would pay 10% of the cost. 230,000 Missourians or more would gain access to health care coverage if Medicaid is expanded. It broadens eligibility to cover individuals who make less than $18,000 per year. An independent study by economic analysts on behalf of the Missouri Foundation for Health and also WashU in St. Louis projects that Medicaid expansion in the state will create more than 16,000 jobs annually in the program's first 5 years, with nearly 80% of that job growth outside of the healthcare industry. On a yearly average, Missouri would see a $2.5 billion increase in economic output, a $1.6 million boost in gross domestic product, and average personal income would grow by $1.1 billion annually. So get this point. For every dollar the state of Missouri spends under Medicaid expansion, $9 are returned to the state. Funds that will keep rural hospitals open and pump billions directly into our economy. That is a great return on investment. I ask voters to turn out tomorrow and vote yes on Amendment 2. Thank you.
Lastly, we want you to hear from somebody who has championed this from day one. The Health Forward Foundation here in Kansas City has been one of the leading advocates for making sure that 230,000 hardworking Missourians, those making less than $18,000 a year, no longer have to choose between putting food on the table and being able to see a doctor. That is one of the most important reasons for people to vote yes on Amendment 2 today. And so we want to hear from the Health Forward Foundation President and CEO, Kiana Thomason.
Thank you, Jack. Good morning. Again, I'm Kiana Thomason, President and CEO of Health Forward Foundation. It's abundantly clear that the pandemic exposed a deep and ugly and pervasive problem in our society: inequity in health care. African American Missourians have been disproportionately impacted by the mortality rate of coronavirus, and studies have shown that this is largely due to a lack of health care access. Amendment 2 will ensure 36,000 more African American Missourians will have access to much-needed health care. Medicaid expansion will help African American workers hit hardest by the coronavirus, many of whom work as frontline health care workers and those holding essential jobs that are low wage, like in child care centers, grocery stores, and as delivery workers. People of color are more likely to live in poverty, and with poverty, they don't have the financial resources to have health care access. Voting yes on Amendment 2 will provide health care to Missourians, including those that don't have insurance with their jobs and who've lost their jobs or have been furloughed due to economic uncertainty. The COVID-19 virus has shown us that no matter what we look like or what's in our wallets, getting sick and needing care reminds us that we're all human. By voting yes on Amendment 2, we can ensure Missourians get the care that we need to stay healthy and well. With Medicaid expansion, we can ensure all of our citizens and our own economy are vibrant and whole, bringing more than $1 billion of our tax dollars back home from Washington each year. More than ever, expanding Medicaid is the obvious path forward, and it's the achievable step and the lowest hanging fruit to Missouri's health and economic recovery and stabilization from COVID-19. Thank you.
Really appreciate everyone being here today. We now take any questions the media might have. All right, thanks a lot, guys.